Hi, I'm Rupal from Resolve Sleep Health. One common issue that patients call us about is that they have a dry mouth. Now, there can be different reasons for this, but one of the common causes is that they are not using a heated hose and they are not setting it to the proper setting. A heated hose is very important because it maintains the temperature of the circuit to allow the moisture to get to your mouth. The setting of the heated hose is also important. I have had patients who have bought a heated hose and they have set it to a very cool setting, around 16 Celsius. This is considered cool, and you are going to get a dry mouth and condensation in the hose. So you want to set it to around 27 or 28 Celsius. I did show a video of this in a previous one that you can look at on how to set it. Also, dry mouth can come from opening your mouth. Now, interesting enough, I had a patient who set her tube temperature from 28, and for some reason, she decided to play with it and had it way down at 21 Celsius. That cooler air and drier air was going into her nose, and she was using a mask that only covered her nose. So that dry air was making it very uncomfortable and was also, ironically, causing her to open her mouth. When she called, she said that she didn't know what happened and she wanted to be fit with a full face mask. I looked at her settings for her hose temperature in our AirView system, and it showed that she had lowered the tube temperature to 21 Celsius. I asked her if there was a reason, and she just said that she just didn't want the warm air. Warm air does hold higher water vapor, and the warm air is what you need for that water vapor to get to your nose and mouth. She did come in, and I did speak to her about it and suggested that we first try to put that tube temperature back up to something around 27 Celsius before we considered changing her mask style. There was no reason to move from a nasal mask that she had used for 5 years to a full face mask unless something else had changed with her health. As soon as we put the temperature back up to 27 degrees Celsius, her mouth stopped opening and she was very comfortable on her nasal mask. That was an easier fix than switching to a full face mask that tends to be very bulky and tends to leak a lot. So if you're having a dry mouth, make sure that you're using a heated hose and make sure it is set to around 27 or 28 degrees Celsius. Also, try to limit any draft or fans in your room around the machine, as this can also cause rainout and condensation. Look out for more videos.